the science behind a PET scan. Hi and welcome. This video series will help you understand step by step how a PET scan works. I created this short introductory video to give you a rough idea of what a PET scanner actually is and how it works. Make sure to watch this video before the others in the series, as this video acts as a base. Let's get started. This is what we'll be looking at today. We'll be covering what a PET scanner is, how it works, where it is used, when it was invented, who uses it, how much it costs, and how it is used in practice. So, what is a PET scan? When I talk to my friends about PET scans, they often think of their pet animal getting a scan. But in this case, PET is something totally different. PET stands for positron emission tomography. It's a fancy way of saying that three-dimensional images are created with the help of subatomic particles, positrons, being emitted within the human body. PET scanning is an imaging technique that uses radioactivity to detect diseases, especially cancer. It does this by measuring the metabolism of cells in the human body. It highlights areas where the chemical activity is lower or higher than normal. PET scans are most commonly performed for tumor detection, diagnosis of heart conditions, and brain scans. Additionally, PET scanners can be used to measure the flow of blood to the heart muscle. The end results of any PET scan are 3D images of the organ under examination on a cellular level. Other well-known imaging techniques include the CT scan, the MRI scan, and of course, the X-ray. These other imaging techniques don't rely on radioactivity. This is what a PET scanner looks like. It consists of a donut-shaped ring with a bed in the middle that can slide back and forth. Here you can see various brain scans from different scanning techniques. The colored image on the bottom right is from a PET scan. If we compare the PET scan to the CT or X-ray image, we can see what images on a cellular level means. That means that the CT and X-ray images show the anatomical structure of the brain, whereas the PET scan shows how metabolically active the cells are. Pretty impressive. How does a PET scanner work? A PET scanner measures the metabolism of cells with the help of a special dye called a radioactive tracer. In this series, I'll be using the terms radioactive tracer, radio tracer, and tracer interchangeably. The radioactive tracer is tailored to the metabolism of the specific organ or the type of disease that the doctors are examining. Imagine the radio tracer being the organ's favorite food, and when the organ is fed that food, it gobbles up large amounts of it. This makes the organ become visible on the final scan, because when the radio tracer decays, it will give off rays that are picked up by special cameras. The total time for a PET scan varies, depending on the organ and the radio tracer, but it takes roughly around 2 hours. The PET scanners themselves are very costly. That is why only large hospitals or specialized clinics have one. Often, the medical department of large universities will also have a PET scanner. In the 1970s, Edward Hoffman and Michael Phelps built the first PET camera. In 1977, the first whole-body PET scanner was invented. Almost anyone can have a PET scan done. Even though it is not recommended that pregnant women undergo a PET scan, it is technically possible. Due to the risk of exposing the unborn to the radiation, it is only done in emergencies. For a few hours after the scan, radioactive material will remain in the body, emitting radiation. That is why one shouldn't be close to children or pregnant women immediately after having had a PET scan. I asked a specialized clinic in Switzerland how much a PET scan costs. They said a partial body scan, so focusing on a specific area, costs around 3,400 Swiss francs, and a full body scan costs around 4,200 francs. These days, most PET scans are performed as a PET-CT scan, which is a combination of a PET and a CT scan. Due to this, the pure PET scanner has almost been pushed off the market. A PET-CT scanner analyzes the metabolism of the cells and the anatomical structure of the body at the same time. This reduces time and costs, as two separate scans have turned into one. Let's look at some scans. The scan on your left is a PET scan. A PET scan is normally displayed as a linear grayscale, where the most intense areas of color represent the areas of highest metabolism. In this example, the black areas represent the highest metabolism. Often, a color scale is added in order to enhance the visibility, as seen in the image in the middle. The scan on your far right is a CT scan. Here you can see the structure of the human body. The scan in the middle is the hybrid, the PET-CT scan. You can see the structure of the body with all the bones and organs, and at the same time you can see how strongly specific areas of the body are metabolizing. The green areas are where metabolism is normal to low, and red often means an unusually high metabolism. But this always depends on the specific organ and on how the range of the added color scale is defined. The next time you're in your kitchen, try recalling what a PET scanner measures. This will help you remember it. I hope you now have an idea of what a PET scan is. Thank you for tuning in to the first video, and see you soon!